Welcome to those who are joining us. Feel free to introduce yourselves in the chat as we get settled here. Welcome. It's the top of the hour, but we'll give a moment or two for people to join us. We're expecting to have quite a few attendees, so please introduce yourself in the chat. Welcome, everyone. As people are jumping online to join us for this session, feel free to introduce yourselves in the chat, and we'll start in about 2 minutes. Okay, I think we're going to get started now. Welcome, everyone. My name is Barbara Lamphere, and I'm a senior advisor at JSI, and I will be the moderator for this session today. I would like to remind you that this session is being recorded and that we will share the recording with you as soon as it's available after the session. Today, I'm joined by climate change and supply chain experts for a session on how public health supply chains can and must mitigate and adapt to the impacts on climate change. So joining us today are Susan Wilburn, Senior Consultant at Healthcare Without Harm, Sayuri Mudliar, Associate Director of Strategy and with PwC in South Africa, Matthews Mwale, Assistant Director for Pharmaceutical Services at the Ministry of Health in Zambia, Edward Wilson, Director of the Center for Health Logistics at JSI, and Gurmeet Philora, also with JSI, a Senior Supply Chain Advisor. We hope that by the end of this session, you will be able to describe how climate change is affecting health systems and health supply chains, and how health supply chains affect climate change. That you'll be able to list key supply chain management levers in public and private sectors that can mitigate climate change, and discuss examples of supply chain adaptations and resilience measures to ensure commodity availability despite climate change. And we hope that you will be able to think of key actions that your organizations can do to advance climate change mitigation or adaptation measures in health supply chains. Our agenda starts with a Supply Chain 101 refresher, followed by presentations from our experts, and then there'll be time for questions from the audience that we can address to the panelists. So we welcome your questions. Please add your questions to the Q&A function in Zoom, and that's where we'll look for them as we are going through the presentations as well. We're going to start our session today with a brief warm-up activity to get you thinking about climate change and supply chains. And so to do this, we're going to ask you to go to Menti, use your cell phone or other internet-enabled device to go to menti.com and either enter this code 11473969 or scan this QR code that's on your screen. So I'll give you a moment to get into Menti, either on your cell phone or on your computer or other internet-enabled device, and enter this code 11473969 or scan the QR code. When you get there, you should be seeing this question: are climate change mitigation and adaptation considerations part of your supply chain strategy? So I'll give you a few minutes to answer that question. We want to know, we want to gauge to what extent you've been thinking about this in terms of your supply chain strategy. Great, we're seeing quite a few yeses. Wonderful. Wonderful. Give it just a few more seconds. All right. Well, it's great to see that several of your organizations, several of you have already included climate change mitigation, adaptation measures in your supply chain strategy, but it looks like there's probably a little bit more work to be done. And we hope this session will help you think of some of the actions that you could take to do that. Okay, our next two questions in Menti, also in Menti, are related. And we want to get your thoughts on this question. How do you feel climate change affects supply chains? So how does climate change affect supply chains? Just think of a few words for how climate change might affect supply chains. Disruption, definitely. That's a big one. Supply levels, emissions, challenges, higher costs. Those disruptions really do end up with higher costs, changing demands, destruction of roads, a lot of transportation implications for climate change on supply chains, transportation disruptions that obviously cause delays and higher costs to getting products to where they're needed. Great. Scarcity and uncertainty. Definitely, and we will be listening. We'll be learning a little bit more about some of the resilience measures that have been put in place in certain countries to handle some of that uncertainty, destructions of roads, scarcity, severity, emissions bottlenecks. Definitely, a lot of this all comes down to that big word in the middle, disruption. Let's move on to our word cloud and the final question in this little warm-up exercise. We have a few more coming in. Great. Sourcing becomes difficult, can be difficult when due to climate change. And I think we also have some raw materials disruptions as well as with climate change. So the next question that we'll move to is just the reverse. How do you feel supply chains contribute to climate change? So how do supply chains contribute to climate change? This will be part of our discussion as well today. So just a few of your thoughts to contribute to this work. Emissions, and I know that's going to be a big one. Waste, biodiversity loss, exasperation, mitigate. Yes, we have, and we need to mitigate the carbon footprint. And we'll be hearing more about the carbon footprint later on in our presentations. Packaging, and the packaging that causes that waste, as well as the products as well, and some of the considerations for procurement about packaging, and how we can try to eliminate that waste in reducing our packaging. There's dwindling supplies, environmental degradation, pollutants. There are significant supply chain contributions to climate change that we need to be focusing on and dealing with as we go through and think about this, what we can add to our strategies to address these issues. Great. Good to see so many contributions here. Wonderful. Okay, I think we're going to move on now. And I'm going to welcome Edward Wilson. I'm going to take us back, and feel free to keep contributing to Menti as we go through the sessions if you wish. So we'll capture that. So I'm going to welcome Edward Wilson, the director for the Center for Health Logistics at JSI. Through this presentation on Health Supply Chains 101, Edward will set a context for us for the presentations and discussions that follow. Our objective here for this part of this session is to create a shared understanding of the key health supply chain elements. Go ahead, Edward.
Great. Thank you so much, Barbara. And good morning, good afternoon, and good evening to everyone. And I'm so glad to be here with you today. So as we get into this sort of brief supply chain 101, I just wanted to frame this by saying supply chains are a critical component of a health system and critical to achieving health objectives. I think probably all of you know that, but I just wanted to put that out up front. And as we like to say at JSI, strong supply chains save lives. Now back to this little supply chain intro. In any supply chain, there are three key flows: product, information, and money. Product flows from producer to consumer. Money flows from consumer to producer, and information is exchanged all along the supply chain. The more seamless and the quicker these flows are, the more responsive and agile a supply chain will be. Supply chains are not static. They are like a living organism and evolve over time as circumstances and needs change, including things such as new products, new consumers, new regulations, new technologies, and new competitors. Next slide, please. Thank you. So this graphic presents a linear visualization of a typical supply chain. Funds turn into orders, orders turn into products, products get stored, delivered, and consumed, and different levels in the supply chain have different responsibilities. Information about supply and demand is exchanged up and down the supply chain. This flow is simplistic, whereas in real life, there can be many parallel and intersecting supply chains that create a supply network. Apologies. Thank you.
Well, we'll just wait a moment for Edward to return there.
Sorry about that. This flow is simplistic, whereas in real life, there can be many parallel and intersecting supply chains that create a supply network. that delivers to the end consumer or healthcare provider. As you can see, all the links in this chain are connected. So if you're looking for bottlenecks, it's important to understand the end-to-end flows of material, information, and funding. For example, if there's no product arriving at a central distribution facility, then no matter how good a delivery system is, products won't reach the consumer on time. Next slide, please. Even though the previous graphic presented a supply chain as linear, it is really a continuously operating system that functions more like a cycle. Serving customers creates demand. This demand is met by products that are carried in the supply chain. Quantification estimates future demand and the supplies that are needed. Procurement makes sure those supplies are available on time. Inventory buffers against uncertainty and allows for routine fixed order or delivery cycles. Warehousing and distribution make sure product is kept in good condition and delivered where and when needed. And customers are served when the cycle starts again. This cycle is supported by a range of management functions that ensure efficient and effective operations. Everything from digital logistics management information systems to performance management to human resource management and so on. Next slide, please. And no matter whether we depict the supply chain in its linear or cyclical form, its purpose is to ensure that the right goods in the right quantities in the right condition are delivered to the right place at the right time and for the right cost. A supply chain is a critical system for ensuring access to healthcare. Achieving the 6 rights is the supply chain's essential contribution to affordable and accessible care. Next slide, please. Health supply chains do not operate in a vacuum. They are a support system within a country's health system, subject to its operating environment and context. The operating environment includes the service delivery infrastructure, the communities where those supplies and services are delivered, and the adjacent public, private, and NGO supply and delivery systems. The operating environment includes government policies, procedures, and regulations, the local socioeconomic context, and transportation infrastructure, among others. This larger context influences and constrains how supply chains operate and what design and operating options are available. For example, a country with a nascent private sector may offer limited outsourcing options, or a country with a well-developed transportation infrastructure may make it easier to centralize inventory and warehouse management. If we take a step back and summarize what we've seen so far in this short presentation, we've seen what supply chains do, how they function, what their purpose is, and how they're constrained. And so why are we talking about this? Next slide, please. So the reason we're discussing supply chains in the context of climate change is because, as you all have noted in the Menti polls, supply chains are critical to health programs, and we know health programs contribute to and are affected by climate change. Supply chains are the biggest contributor to climate change in a health program, so they are essential to consider as we look at mitigation and adaptation efforts. And climate change is disrupting supply chains, so at looking at how to equitably deliver health services in the face of climate change, we have to consider mitigation measures for supply chains. Through the rest of today's panel, we will get into more details on each of these. Next slide.
So thank you, Edward. We have an opportunity now to have anybody ask a few questions of you about how the relationship of health supply chains and climate change in a general sense, or health supply chains in general, and the health systems. Does anybody have any questions for Edward? Or Edward, do you want to bring in any other points? Okay, I don't see any questions in the Q&A. All right. Edward, do you have any other final points that you want to make before we move on?
No, I think that's it. Hopefully this has given people a sense of the supply chain levers that are available when we start to consider risk mitigation and adaptation measures.
Okay.
Look
So
forward to other questions that people might have.
Okay, great. Well, we'll keep this context in mind as we move forward for our next presentation, which will be by Susan Wilburn. Susan Wilburn is from Healthcare Without Harm, and her presentation will focus on how climate change is affecting supply chains and how supply chains impact climate change. So we'll have a lot to learn from Susan and her presentation. So Susan, please go ahead.
Thank you very much, Barbara and Edward, and many thanks to JSI for organizing this session. It's a real privilege and pleasure to be with you all here today. Next slide, please. In the next 15 to 20 minutes, I'm going to talk about the impact of climate change on health and our contribution in the health sector to climate change, and give some examples of tools, resources, and solutions to the problems that we all face as we need to achieve a reduction in greenhouse gas emissions in order to not exceed planetary boundaries. Next. So I look forward to hearing more from all of you and discussing what can global funding mechanisms, supply chain professionals, and procurement policies and processes do to advance sustainability and address climate change, and certainly at the very least not to undermine sustainability efforts that are ongoing. Next. And just to remind us that climate has been a known health issue for centuries, with this quote from Hippocrates in his publication on airs, waters, and places from around 400 BC. So climate is not a new subject, it's quite an ancient health determinant. Next slide. The impact of climate change on human health, I think, is well known to everyone in this conference. But just to say that this slide that comes from the WHO talks about the wide range of health outcomes and significant climate change impacts. So the inner circle talks about what we see in terms of rising temperatures and extreme weather events. I am here on the west coast of the US and Canada, where we have for the last 4 years seen increasing fires and resulting air pollution from the smoke, and therefore exacerbation of asthma and cardiovascular disease as a result. But you can see that we've changed vector ecology and are seeing, I remember it was now 15 years ago that chikungunya was first seen in southern Italy, where it had never been seen before as temperatures are rising. And as we know, in the mountains in Africa, there are vectors that were not previously there because of snow and ice that is now disappearing. Next. Back in 2008, the World Health Organization published a report on climate change and health as part of World Health Day. And this is a quote from the then Director General, Margaret Chan, that she said that climate change is the greatest global health threat of the 21st century, followed by the next year, a series in the Lancet where they talked about climate change as being the greatest health opportunity. And we are a part of this threat and opportunity moving forward. Next. The health sector, if the health sector were a country, it would be the 5th largest greenhouse gas emitter on the planet. Now, this is not consistent across countries and systems. The United States health system represents 10% of the US global greenhouse gas emissions on average. It is almost 5% of the emissions of a country comes from the health sector. And I'll talk later about the climate and health program from the COP26 from the UN climate talks last year, and the climate and health program in countries that have joined to manage, measure, monitor, and reduce their emissions. Next, please. When we talk about climate change and greenhouse gas emissions related to the supply chain, this is a very common graphic where you see the types of emissions, scope 1 emissions being direct emissions, scope 2 being indirect from purchased energy, and then scope 3 where supply chains reside, representing 70% of the health sector's greenhouse gas emissions from both upstream and downstream activities. And the next slide shows this a little bit more specifically to the health sector and what health products and services fit within the various scopes. And the top of the slide is the various chemicals that make up greenhouse gas emissions. So not only CO2, but methane, nitrous oxide, fluorocarbons, hydrofluorocarbons, and others. Next. The greenhouse gas emissions of the health sector are not the only impact. And as we saw from the Menti slide, many people were talking about the issue and the challenge of healthcare waste. Healthcare sector, including in the supply chain, does contribute to many environmental problems. There's the highly hazardous chemicals that we use, many of which are therapeutic for our patients, but not therapeutic for either the providers of those or administrators of those chemicals and pharmaceuticals, nor the environment as a whole. There are, as we have seen during COVID-19 pandemic, human rights violations in the supply chain, and air pollution, not only from healthcare operations, but especially from incineration of healthcare waste. Next. To hone in on greenhouse gas emissions, the National Health Service in England has done the earliest and most comprehensive analysis of emissions of the sector. And what you see here on the right, the pie chart, is looking at what the 3 key areas to focus on if the system is going to reduce its greenhouse gas emissions. And what you see is 13% of emissions in NHS England come from travel, 15% from building energy, but the vast majority, 72%, are from supply chain and procurement activities. And the graph on the left, the bar graphs, illustrate what are those carbon hotspots in the supply chain. So the highest in the case of NHS England comes from pharmaceuticals, the second highest from externalized business services, and the third from biomedical devices. So a lot of products that we need to look at and identify suppliers with whom to work to reduce the emissions in both manufacture, transport, use, and waste. And it's also interesting that the NHS was one of the co-sponsors of the Committee of the Parties, the COP26 climate talks last year in Glasgow, and launched together with WHO and Healthcare Without Harm, the COP26 Climate and Health Program, which I'll speak more about next. At the same time that the NHS was looking at their greenhouse gas emissions, UNDP took a look at global funded projects in this case, Montenegro and Tajikistan. They also looked at in Zimbabwe and 2 other African countries, and did a carbon footprint of the programs where they were administering, where they were the principal recipient of Global Fund for HIV/AIDS and tuberculosis. And in summary, what you see using the Stern report, costing out the cost of greenhouse gas emissions, which most say is quite a vast underestimate, is that about 5%, 5.5% of the total program was essentially going up in smoke as greenhouse gas emissions. And it did identify priorities in products and in transport, as well as services for reducing emissions moving forward. Next. So let's talk for a few minutes about how to address climate change, especially the emissions created throughout the supply chain in implementing sustainable procurement and working together across hospitals and health systems, across mobilization of governments to engage the private sector, to engage our suppliers and assist them in moving healthcare toward a net zero. Next. I mentioned the COP26 Health Initiative. During the launch of the initiative now 1 year ago, 52 countries adopted the Climate and Health Program. It is now up to 62 countries that have made a commitment, including 22 countries that have agreed to go net zero and reduce their carbon emissions. The NHS being a leading example with an intention to be carbon negative in the next, by 2030. There are a number of initiatives that governments, suppliers, and health systems have joined. The Race to Zero is an initiative that is sponsored by the UN Framework Convention on Climate Change. And for health systems, Healthcare Without Harm manages the participation now of something like 44,000 health systems that have joined the Race to Zero through the Healthcare Climate Challenge. Next. There are many tools that are available to all of you for action about how to integrate sustainability. There are guidance notes for governments. There are self-assessment checklists and tools for looking at the various contaminants that contribute to climate change. Next. One of the tools that was published last year, which is a tool that was developed together between the UNDP and Healthcare Without Harm, is this Sustainable Procurement Index for Health. This is a tool that is designed for supply chain officials, for procurement officers, and for suppliers who want to do their self-assessment to use this tool during a procurement event or in pre-qualification for procurement events. And the tool itself is a comprehensive tool with 4 modules, as you see on screen: greenhouse gas emissions module, a resource depletion module that looks at water contamination in supply chains and waste, chemicals and toxicity, restricted substances, and asking suppliers to reveal, to be transparent about what products, what materials and chemicals are in their products. And there is a module on gender, human, and labor rights. Next. This, as I've said, there are 4 key theme areas which represent sustainability challenges. Within each theme, there are governance aspects and product-specific considerations, as previously mentioned, such as restricted substances that may be listed by the Stockholm Convention on persistent organic pollutants or other environmental conventions, such as the Minamata Convention on mercury, and eliminating mercury-containing measuring devices from healthcare. Next. What you see is just an example of the Excel-based tool. There is an Excel-based tool that can be downloaded and completed, and also an interactive web-based tool. Next. This is an example of module 1 of the first theme of greenhouse gases. Each of the modules, of the 4 modules, has 3 levels: a basic level, an intermediate, and then an aspirational level. The procurement officer could set a particular level in order to be eligible for a procurement event. And you can see the questions for this module are quite basic. Do you measure your scope 1 and 2 greenhouse gas emissions? yes or no, and you can get a variety of points depending on whether it's a recognized methodology or another methodology that is not identified in the index. And then reporting. Are you reporting it? Are they published internally or externally? And the more public your publication of greenhouse gas emissions, the more points you get within the module. There is also, next slide, a separate index just for pharmaceuticals. You can see the pharmaceutical Excel sheet on the right. And so looking at, as we saw, the NHS in England, their main carbon hotspot was pharmaceuticals in the supply chain. They worked with the 5 top suppliers of drugs to the system to develop a sector guidance note, greenhouse gas accounting, guidance for pharmaceutical products and biomedical devices that is now being used by these companies that supply to NHS. And the National Health Service, through the Sustainable Development, is asking their suppliers not only to measure, but to report and to work with them on reducing. So some of the activities that can be used around these hotspots in the supply chain to measure, monitor, and reduce emissions include the sector guidance note and the special index version for carbon hotspots in the pharmaceutical supply chain. And then as we identify the suppliers that represent these hotspots, to invite them to join the race to zero, as thousands of governments and health systems have. Next. There is a great momentum that is moving forward to mobilize the health sector for climate action. And as we know, if the health sector leads by example, other sectors will follow. The UN One Planet Sustainable Public Procurement Program is working with governments on climate and other sustainability issues. There is an interagency task team that includes 7 UN agencies. I've mentioned WHO and UNDP are among them. UNICEF, UN Operations, UNFPA, and UN Human Rights are all a part of this interagency task team, including 3 global funding mechanisms. Global Fund is currently the chair of the interagency task team. UNITAID and Gavi are also a part. Many health systems across the world have joined the race to zero. Here it says 52 governments. It's now up to 62 in the lead up to COP27 in Egypt. Next slide. I won't go through this slide, but there are many countries and regional initiatives, including the SADC, South African Development Community, and the 16 countries of SADC have signed on to a pooled procurement program that includes sustainability. And in India, there is sustainable procurement embedded in the national private hospital accreditation standard, and also moving forward policy in the public sector. So this is just an example of where countries are moving forward to implement and integrate sustainability in their systems and in their procurement. Next. Coming to the end of this presentation, as we are responding not only to the climate instability from climate change, but thinking about how we can continue to improve and sustain sustainability measures during conflict and crisis. You can see work that has been done on waste management during COVID-19, and what has happened to some extent around the pandemic was both an increase and unnecessary use of some disinfecting chemicals. And you see a fact sheet about the unnecessary hazardous use of disinfection tunnels that Healthcare Without Harm produced, and then worked with WHO on a myth buster as countries were spraying people on their way to, for example, the How train in South Africa, on the way into Parliament in Vienna, in unnecessary and hazardous use of chemicals. Next slide. So looking together with you, the way forward to align with the COP26 health commitments to decarbonize the global health supply chain to foster climate smart, resilient, sustainable systems. Look forward to hearing more from the next speakers about their efforts, and to promote health equity, gender, and human rights by leveraging healthcare's purchasing power. Next. There are many personal, systematic, and professional activities around carbon reduction, and here's one of the simple personal ways to reduce carbon emissions. Next. And this is my last slide. And again, thanks to JSI and thanks to all of you for your attention. Part of the reason why we are doing this work in the health sector, the one sector that has a mission to heal and first to do no harm, is as we look at transforming our practices and products within the health sector and the markets that supply our systems, we can, by example, demonstrate to other sectors of the economy and influence and transform the global economy so that we will not exceed 1.5 degrees centigrade. And that this planet, as you saw the first slide, there is no planet B, so that we can protect this environment in which we all live, work, and play. Thank you.
Thank you very much, Susan. It was quite inspiring and a lot to think about. We have time now for a few clarifying questions for Susan's presentation. We do have a question in the Q&A that we can address now, I think. And the question is there a good central website for accessing the tools that you presented or some of the information that you presented? Oh, you're on mute.
Thank you. There are 3 websites. I'll put the websites in the chat. The website that includes all of the UN interagency tools and resources, and the websites on procurement from Healthcare Without Harm. They are also in the slides, which will be made available to you, but I will put them in the chat now.
Right. I do want to remind you, and thank you, Susan, for saying that the slides will be made available to you, and we are recording this presentation, and we will be sharing the recording after when it's available after the session. So no worries, you'll have access to this information as we move forward. Okay. If there are any questions for anything? Okay, and we will share. Susan's going to be putting the names of those websites, and we'll be sure that you get the names of those websites that she's referring to in our follow-up with you after this session is done. Okay. Well, in which case now I think we will move on to our next presentation by Sayuri Mudliar, and Sayuri is going to be doing a presentation that comes from a private sector perspective from PwC South Africa on mitigation efforts and opportunities. Let me move the slide here, and opportunities to reduce supply chain impact on climate. And she will be offering a few case studies from work with organizations in Africa on the work that they've been doing. So please go ahead, Sayuri, and we look forward to your presentation.
Thank you, Barbara. Good morning, everyone. So Barbara, if you can go on to the first slide. I mean, Susan's already given quite a bit of the global context, so I'm not going to go into any of the detail on the slide. We've already spoken about the fact that the healthcare sector, if it were a country, would be the 5th largest emitter in the world. Its climate footprint is close to 5% of global net emissions. And we also spoke about the fact that, about 70% of these emissions are linked to the supply chain. And this slide really just talks about the global response, but I think I'm not going to go through it in any detail. If you can move on to you will get these slides, so you can look at those examples. I'd like to focus a bit on Africa now. So Barbara, if you could move on to the next slide. I think one of the things we're finding is that the critical issue when we talk about emissions has to do with the medical supply chain, which poses specific challenges for the public healthcare providers, many of whom are private sector clients of ours. So the reason that there are these challenges Firstly, is because supply chain emissions are not usually under the direct control of the entity that's reporting the emissions. Also, if we look at what the mandate of the public healthcare system is, it is to provide healthcare to people within a country. And often when that is your priority, you need to do that in the most effective way possible. And that might not always take into account climate change considerations. Budgetary constraints are also quite important in terms of the challenges that we face. And when you're facing crises like the pandemic that we've seen recently, shortages can lead to overlooking issues like climate change and environmental considerations. If you can move on to the next slide, Barbara. So just to talk a little bit about what is mitigation versus adaptation, we spoke about the two sides of climate change, one where our supply chain affects climate change, and the other side, which is where climate change has an effect on the supply chain. So when we talk about mitigation, which this presentation is about, we're actually talking about how we can make the impacts of climate change less severe by either preventing or reducing the emission of greenhouse gases into the atmosphere. This is different from adaptation, which is more passive, and that is the process of actually adjusting to whatever the effects of climate change will be. If we move on to the next slide. I'm going to talk about 3 case studies from Africa. One of the things we find, and you'll see that this is a common theme with these case studies, is that often when clients come to us about these issues, the main concern that they have is how do they actually go about measuring and tracking greenhouse gas emissions? Sometimes many of the players within the supply chain may not be large corporations, and they may not have the tools to do this. So that is one of the things that we find quite commonly in projects that we're involved in. The 3 case studies I'm going to talk about, one is from Nigeria, one is from Kenya, and one is from South Africa. I'm obviously not going to mention our client names. And you'll see that the case studies are actually fairly, I'll go through sort of step by step what we did during these projects, and you'll see that they are actually fairly simple steps. And I hope that they'll enable you to start thinking about what you can do in your organizations or organizations that you advise. These are not complex things that you need to do if you know what to do and what steps to follow. So if we go on to the first case study, if you can go to the next slide, Barbara. Thank you. So in this particular project, we were looking, our client was an industry association of medical technology companies, and they approached us to provide some benchmarking and guidance for their members. So what was a bit of a challenge with this project was that the client was the association, but the end user would actually be the members. And the specific challenge for this project was that the members were from across the board within the medical technology field, from large multinational manufacturers of equipment to the local doctor who had invented some sort of electronic brace for his patient's knee or elbow. So our project had to, and the tools that we provided had to be flexible enough to provide guidance for all of the members of the association. What we did during the project was we started out with our benchmarking, and you can see it's fairly simple. Almost any organization can do this. You don't have to actually come to a huge consulting firm. There are various niche consulting firms that can also help with these sorts of things. As Susan pointed out, there are lots and lots of tools available to do this kind of work. So with this particular project, we started out with benchmarking. The association wanted us to do a market scan to find out what the healthcare sector as a whole was doing regarding climate response, what the effect would be for medical technology companies in the supply chain, what similar associations throughout the world were doing, and what the guidelines and requirements were of the public hospitals and clinics. And then to look at the trends and concerns of other medical technology companies that belong to the association. So this was a desktop study, of course, and from this we then provided a climate response framework for the association that they would then recommend to their members. And this included recommendations on how to reduce greenhouse gas emissions. And because of the variety of association members, we also included a fairly simple diagnostic gap analysis tool that the members could use. And this would enable them to then take the results of that gap analysis either to approach us to help or to go to any other consulting firm to assist them with how to close that gap. We also helped them to put together an e-learning, which was a whole campaign on what climate change meant for the medical technology industry. And this comprised various modules, including introductory training on greenhouse gas emissions and how to measure and track these, which, as I've mentioned, was something that was a serious concern for the specific members. So if we go on to the next slide, this is the second project that I thought I'd just discuss today. This was in a country that had both a sort of state level health ministry as well as a federal health ministry. And we were approached by one of the state health ministries to help with putting together a more sustainable procurement strategy and policy, as well as proper guidelines for their suppliers. This was also started out with a desktop study. We did an analysis of the federal and comparable state strategy and policy documents, and also looked at various regional documents of comparable ministries within the country. We then conducted interviews and surveys of the relevant stakeholders and went on to then draft their strategy and policy. In terms of the rollout and feedback, we conducted various workshops for the rollout and got feedback from various stakeholders. The next step was then to actually draft the supplier guidelines. And in order to do that, we had to survey and conduct interviews with the various suppliers and then draft the guidelines. And then we did information sessions and got feedback from the suppliers. I think one of the things about this project was, of course, the client was the state health ministry. The end user would have been the procurement departments as well as the suppliers. And the overall goal of the project was to overhaul the procurement strategy of the specific ministry and translate this into practical guidelines for their suppliers, many of whom were small and medium enterprises. I think the challenge here was the number of stakeholders, and we found that the project took substantially longer than we expected because it ended up being quite an iterative process. And I think that's one of the things we find, especially in the climate change field, is many of the projects are not just a straight line chronological order process. They're often iterative, especially when you're dealing with supply chains. There are various stakeholders, and by the time you get to the end of the process, you need to go back to the beginning to make sure that you've taken into consideration all of the different factors. If we move on to the next slide, I can talk about the third case study, and this is another project that we did. This was a private sector pharmaceutical company that was tendering for a government contract. And in order to do that, they had to comply with not just the government procurement policy, but all of the conditions that were set out in the tender documents. So we started out by doing a desktop study, and that involved the analysis of the government procurement policy and the tender documents, as well as the distillation of all of the relevant requirements that were applicable to pharmaceutical companies that were tendering for the contract. What we found once we had done this is we then went on to a gap analysis, identified what the outstanding qualifications were when we looked at our particular client, and drafted an implementation plan to close this gap. This was quite an interesting project because the implementation plan ended up being a substantial data science project, a data science solution that we implemented. It also was a global project that we had to enter into together with our US and German offices. And that was because the risk modeling needed data that was available globally from various sources. The climate risk modeling tool, we created that tool. Specifically, it was a bespoke tool for this particular client. And the idea of the tool was to be able to monitor, measure, and track the climate risk metrics that included scope 1, 2, and 3 emissions. And this leg of the project involved the rollout of the climate risk model to the organization, which involved training people within the organization to use the tool. In addition to this, in order to tender for the contract, the organization would be required to provide specific reports. And we used the opportunity to overhaul the entire reporting framework, which would then encompass all of the various global standards and guidelines, so that whatever reports they produced would then be used for various purposes, including for the government contract. And so we developed their sustainability reporting framework, and this included the climate risk modeling and scenario analysis. So these are just three examples that I've used to show you that there's quite a variety of work that is done in this area, but once you break them down step by step, they're fairly simple steps. And like I said, often the clients, especially the smaller clients, really come to us because they just don't know how to measure, benchmark, and monitor greenhouse gas emissions. If we go on to my last slide, Barbara. I'm not going to go into every single point on the slide. You can read that at your leisure. But if I just group these questions into categories, I think the key questions that we find that we're asking our clients when we go into these sorts of projects is, firstly, how do you assess emissions and climate impacts? What are your measuring tools? How will you monitor them? And then always questions on the supply chain. And when we're looking at it from a strategy perspective, and I work in our strategy consulting division, so we're always asking questions about transformation, about the operating models, and about the strategy of the organization. That always brings up lots of opportunities for transformation of organizations. Innovation and technology is always really important. Many of our solutions are data intensive, that involve scenario analysis and modeling. And then culture and people are always absolutely key to any implementation, because no matter what kind of model you put together and how much of advice you give an organization, it really always boils down to the culture and people in terms of how successful the implementation is going to be. And then just one more point, we often find that working in partnerships has provided great results for us. We have lots of smaller organizations that partner with us that do specific, for example, data science and IT parts of our projects, that provide lots of information and are able to give us, especially from a data perspective, a lot of insight into our clients. So thank you very much. I don't know if you have any questions.
Are there any questions? There's a question from David, and I think that we could address this now, because it says, in your experience for effective greenhouse gas emissions accounting and reduction initiatives, is it necessary to bring in external expertise, or can it be done in-house? Since you've been talking about your experience providing technical assistance to these organizations, what's your perspective on this?
I think one of the things we're finding is that there are lots and lots of companies that are doing this. I think, many of our competitors on these projects are a lot of these smaller bespoke companies, and especially in terms of carbon markets and greenhouse gas emissions, many of our competitors are consulting companies like engineering firms, but there are smaller companies that you can use. And from these smaller companies, there are many experts that go into organizations as in-house experts as well. I see many of our clients sometimes use the secondment option. So instead of using a consultant, for an entire project, they may reach out to a consultant and ask for a secondment of almost like an employee for 6 months within their organization. But certainly there are lots and lots of experts. And as you know, there are many qualifications and certifications that people can get from various organizations that enable them to then work as employees and provide this kind of expertise. So of course we'd prefer people to come to us, but there's absolutely nothing stopping, and especially for smaller organizations, you can have the internal expertise You can use smaller consulting firms, and many big organizations, of course, have entire departments that do this sort of thing.
Right. And I think, Susan, you mentioned a few some tools and processes that are accessible to people that, and can you comment on it, whether you think people within this can
And
be an
I
in-house?
also, yes, thanks, Barbara, and very interesting presentation. Thank you, Sayuri. I put in the Q&A, one of the answers is those countries and health systems that have joined the COP26 health program can have access either through Healthcare Without Harm or WHO to the climate impact checkup tool. And there is an accelerator program that has just been launched by WHO called Attach to accelerate participation in the climate and health program. And that is in the accelerator program, there's working groups on sustainability and resilient health systems, and there's working groups on procurement. Then the working group on procurement and supply chain is being co-chaired by NHS England and the Ministry of Health from Maldives.
I actually have a question. Thanks, Susan, for Sayuri, and without giving away any client specific information, but can you give us some examples, say for the case study of the state health department, some examples of the kinds of policies or that would have been necessary to implement to improve their procurement in line with climate change mitigation?
Mm-hmm. Yes, so I mean, I think, you know, it's often very country specific, excuse me. So we usually start from what the global requirements are, and that we'd look at whatever standards might apply to that particular country, any obligations that they might have, global obligations and that sort of thing that that particular country has signed up to, that would apply within a public sector sort of environment. And then we'd go down into the legislative environment. And in this case, the particular country we were looking at, they had substantial legislation in place, so both from a federal perspective and a state perspective, so specific things. And when we look, so this particular project went beyond climate change actually, because it was looking at sustainability. They were putting together their a sustainable procurement framework. And that meant when you're looking at sustainability, you're also looking at ESG issues, which then encompasses a lot more than climate change, because the social issues, and as you may be aware, when we talk about ESG in Africa, the social issues are quite significant. So social issues like gender empowerment, Black economic empowerment, using local suppliers, empowering women and youth through entrepreneurial sorts of initiatives and those sorts of things from a social perspective. Also socioeconomic indicators, like how you would transform particular communities in which you're operating. Sometimes also using suppliers that are contributing to the achievement of SDGs, for example, of that particular government department or the government as a whole. So those sorts of things. So it always starts from the global perspective, then moving to regional, and then possibly legislative, and then taking into account the socioeconomic and ESG kind of perspective as well.
Right. Do we have any other questions for Sayuri? Okay, well, that you really set us up to move on to some very specific country examples, and we're going to welcome Matthews, who will be presenting on some of the preparedness and resiliency measures in public health supply chains as they've been applying them in Zambia. And so I welcome Matthews to the floor. And look forward to
thank you, Barbara, and thank you, the panelists and colleagues who are attending these important sessions. Next slide. Yes. Next slide, Barbara.
Okay, maybe a slight delay for.
We can go to the next slide, Barbara.
I'm in the historic weather and climate
Thank you.
observations. Great.
Yeah, so so when you look at what has been discussed by other panelists, I think we may be thinking it's far-fetched, within our context, but I think this is what is clearly being detected. Our temperatures have been recorded to be on the increase by 1.3 since 1960. That is, on average, we have a 0.3, just under 0.3 degrees Celsius per decade. That is our country context. And since 1960, in terms of rainfall, we have reduced rainfall by 1.9 millimeters per decade. And are we looking at anything getting any better? I think that the next slide will be able to discuss that. But while we have a reduction in the rainfall, we are indeed having floods and droughts on the two extremes. And the projections, like I've said, in terms of temperature, we're not getting any better. I think that is projected that it will continue to increase. And even the intensity of the rainfall, again, in this country will continue to increase. Next slide, Barbara. So what are key sectors? What are these key sectors in this country that are vulnerable? I think, like everyone knows, when you tamper with the environment, the immediate impact is on health, food security, water resource, forest and grass, wildlife. But for the purpose of our discussion, we'll zero in terms of the health sector. The next slide. So what we have observed is that there has been a surge in terms of the numbers that have been recorded, the disease burden for diarrheas, when we have floods, in hot and humid conditions. We've had increase in the cases of malaria. And now again, we have respiratory infections that have come up, and also what we could have thought that we have sorted out the cases of cholera. In the recent past, I think we've seen this are coming to the fore. And in certain sporadic situations, we've had cholera, just sprouting up, depending on what the climatic indicators could be on that particular in that particular season. Next, Barbara. So when you look at the burden of the disease in terms of supply chain, it follows that when you have a huge burden of disease, even the consumption as well will follow. And at different levels of our supply chain, we get affected. At manufacturing level, we have intensity in terms of production and the demand, to satisfy the demand. But of course, on the other side, we know that, we are energy intensive, we are material intensive, but that goes without saying that we are also waste intensive. And these are effluents that are discharged in the environment. And most of our companies right now, these are the things that we are observing. No clear, guidelines on how you discharge or even treat the effluents before you discharge them in the environment. So at distribution levels, when we have, floods, heavy downpours, we have over about 400 facilities across the nation which are cut off during the rain season. And so these are some of the impacts that we have in terms of distribution. Storage, again, for cold chain, in a situation where we've had inadequate rains, hydropower station generated energies tend to become erratic. And so there is demand for alternative, and the closest alternative that we have in this country is diesel power generation, power generators. And these are the impacts that we have. While we are trying to sort one problem, I think we are also causing more emissions in terms of, the diesel power generation. Then at service delivery point within the supply chain, again, we have various, issues that have to do with, when we look at the delivery points, we are looking at the effects that we have with our clients when roads and bridges, most of the bridges are cut off. We have to think about how we can deliver the service. Most of them come to the service from where they from their homes, and they use some of the roads that could be impassable. And we see that we also have a difficult time to try and deliver the service to the so-called hard to reach areas. I think even in the recent past for COVID vaccination, this has also impacted us in terms of delivery to the hard to reach areas. Next, Susan. So the question now is that what we are observing in the country is demanding that there should be a shift in the way we've done things, and not work as usual, but maybe thinking outside the box. What we are happy about is that the current government has demonstrated political will for the first time in this country, in establishing a Ministry of Green Economy and Environment, to look at how monitor climate change and its impacts and the risk and so forth and so on. So we are happy that we have this we have this ministry that could even change policy and affect the way we have operated as a nation. But in terms of the health sector, I should be happy to announce that in 2016, 2017, we have a national health sector supply chain, national health sector adaptation plan. What we may not see in the national health adaptation plan, which addresses the 4 conditions that as climate or as climate sensitive that I've earlier on discussed, is that we may not see something under the supply chain. And this is what now for us as supply chain experts, we now begin to look at how best can we also leverage on whatever is existing under the health national supply adaptation plan. How do we contribute to our supply chain adaptation plans as well within the national health supply chain and national health adaptation plan? Formulation of government framework and programs. I think this is what our national Ministry of Green Economy and Environment is working at. How best can we have sector-specific programs? I've said that we are considering there are certain flood-prone areas where we are considering the issue of using drones. I think some time back JICA supported us with this initiative. It may not have gone very far, but it assisted because of the carrying capacity. It assisted with the transportation of samples for TB, samples for HIV, but we want to think beyond just samples and increase the carrying capacity. And these discussions are within our supply chain corridors to see how best we can take advantage of technology and overcome the challenges that are coming as a result of the extreme in weather conditions. We have in Zambia a specific department under the Ministry of Health that is called the Zambia Flying Doctor Services. They use aerial vehicles, planes, choppers, and so forth and so on. So as supply chain managers as well, through our central medical stores, there are engagements that probably during the times that we've had roads that are impassable, bridges that are broken, during the times that we have had floods, is there a possibility that we can partner with them so that we can start, using them for transporting supplies across, difficult terrains? Differentiated models are one of those that I earlier mentioned at service delivery point. I should be thinking about supplying for the chronic diseases much more than just 1 month. That also will speak to the amount of commodities that we should be stocking, and also affect in terms of the storage, front loading of supplies. And currently I'm happy that in our country we have 10 provinces. We have decentralized central medical stores into 7 of them, and collapsing the distances. Obviously that is helping us to reduce the distance between the service delivery points, as well as the the number of hours that trucks that could centrally pick commodities to go to the peripherals, and also affecting the environment by doing so. One key issue that has come out very, very clearly, and is something that we are sitting around the table to discuss, is what could have happened in the 2020 to 2021 season, where our estimates were consumed in 1 year. In fact, we had 2 years consumption of antimalarials in 1 year. And we have been brainstorming to find out, is it because of pufferage? But no, the quantities are too much. But of course, we are looking at how best can we improve, in our quantification, in our supply chain management of antimalarials. How do we improve and enhance innovations such as the seasonality models that would look ahead and provide accurate data, and also supply demands whenever seasons change. So this is one thing that we are recently going to be launching, rolling out in the facilities, and we should be able to, see how and learn lessons, whether this will help or not. But I think in terms of malaria, it being malaria being a climate sensitive disease, we also expect that this supply chain will be climate sensitive, and therefore we need to employ certain innovations that would adjust and be sensitive to the consumption that fluctuates depending on what season that would be. So this will be launched. I'm hoping that by next year we should be able to learn lessons from here and see whether what was consumed within 1 year for 2 years, consumption was just out of a sheer, increase in the malaria cases, or did the climate have a lot to do with that? And then in terms of resiliency, most of us agree that our African countries depend over 70 to 90% commodities from outside, and supplies that come from outside also may be affected by climatic changes from outside. And in our country, recently we've formed what is known as the Zambia Farmer Manufacturing Initiative to try and see how we can localize and promote localized manufacturing of pharmaceutical products to increase resilience in terms of pandemics and epidemics that could affect the supply chain, as could have been observed during the COVID pandemic. Next slide, Susan. So we are thinking, and some of the topics now in the corridors of supply chain is that how best can suppliers, manufacturers, become, more energy efficient, and reduce the emissions, reduce the demand and pressures on energy. Also, we are looking at cold chain. I'm happy also to know that I think this is not just a vision, but most of our small facilities, the health centers, have had to benefit from solar installations, and that could also be helping with the storage facilities. With the support of the Sustainable Health Procurement Program or project supported by UNDP, as was seen earlier on, is that we have begun to relook at our essential drug list and look at the chemicals of concerns and see how alternative drugs that are could sustain the environment, and also while they are treating people, could help us, be the alternative to the chemicals of concerns on that list, and presenting to a bigger group. We want to also integrate climate change in our supply chain health strategy. I think we have an opportunity now. Our health sector supply chain strategy is due for revision. We should be able to include, some of these climate change initiatives, so that we become smart in terms of how we are looking at our supply chain. Our national drug policy as well is due for revision. So these are policy issues, and they are presenting to us opportunities that could help us include climate change issues within our documents or our governance documents. Within the supply chain, like I said, sometimes vehicles move miles and miles, emitting, a number of emissions. We are thinking that if we could collapse the distances, we could also help in the emission of these greenhouse gases. And also, if we could also look at how best we can provide energy efficient vehicles. Is it electrical? I think we are dreaming, but this is what we are thinking about. How best can we look at our environment? I think that if you look at the recent news regarding our country, we are losing about 300,000 trees per year. And this is number, you know, in terms of deforestation, we are #1 in Africa and #3 in the world. So we are not better placed if we do not act now. So these are things that we are now looking at. How can we contribute as supply chain managers to ensuring that our environment is well, guarded? So we are looking at the guidelines for donations. One of the panelists mentioned about, resource constrained nations like ourselves. We receive donations. Some of the donations are dumped on us, and I think I'm sorry to say that, but that is the truth. They're dumped on us as a way of disposal, and it is affecting our environment. So we are really looking at the guidelines and say, what can we get from the outside? Should we accept everything, or should we accept what is necessary? And the terms of how we accept those. Could we look at also our disposal guidelines? I think I'm coming from the service delivery point up the radar. I've experienced how we have to dispose pharmaceutical waste in a much more, in what leaves an impression that I think that we are affecting the environment by doing this, because there's no systematic way of doing. Can we look at, pharmaceutical incinerators and see how best we can, reduce the effect of the environment? The disposal itself is one that, brings home the number of commodities in small quantities, but in our households that are being flushed through, the drains and, the sewer system. And of late, I think that maybe we are saying that we are overfishing in our natural environment, but I think that we need to assess and find out whether what we are discharging in the environment is also, affecting the fish population. It's unthinkable. In the past, yes, there's aquaculture, but in the past, we used to have naturally filled, water bodies with natural fish. But I think that this has depleted of late, and that nobody wants to explain that, and nobody wants to probably understand what is happening. But we are suspecting that what we are discharging in the environment is affecting the aqua system. Sustainable health procurement, I think that is my last point. And, I'm happy to mention that we began well with UNDP, and this is what now we've implemented. We have implemented to reduce waste in terms of the packaging. We are now asking companies to provide at least 3 months of packaging, in a single bottle. We have 90 tablets instead of 30 tablets, 3 packaging materials for plastic bottles. So we are reducing the number of waste. And eventually, I think there should be a way that we agree on how best we can include some of these things in our supply chain document, like I saw Sari talking about it. Next. So just something to reflect on, over 90% of our pharmaceutical supplies come from outside the country. And obviously we are vulnerable with climatic changes within and without the country. Disruptions can be seen at different levels, and therefore there is a significant demand for us to rethink and look at how best we can practice our supply chain, which is more environmentally friendly. Thank you.
Thank you, Matthews. Does anybody have any specific questions for Matthews on his presentation? If not, we will go into the Q&A section. Right, I'm not seeing any specific questions directly. Oh, Susan, yes.
Thank you. I was trying to chat, but was unsuccessful. Matthew, thank you very much. One question I have, as you were reflecting on the, as you described it, dumping of some donations, and I'm wondering within Zambia, what collaboration and coordination is necessary in order to, is it with trade and the ministry, and how do you address any unnecessary product that's coming across your border, and what are the partners with whom you need to work in Zambia that may be an example for other countries that have a similar challenge?
Thank you, Susan, for that wonderful question. Within our supply chain, we've defined the key partners. Number one, we have the regulators who are at every border of an entry point. We also have our, national medical stores. We also have the ministry, and I'm happy that I'm sitting at the ministry where policy is being designed. And maybe we could use this particular, influence to see how best we can couch the donation guidelines, so that whoever wants to donate, they are subjected to, sustainable ways of donating these things rather than dumping them. So we've had to discuss with all of these partners, including, our Zambia revenue authorities also found at the border. So they are made to be aware that they detain these commodities if they do not have documentation. So these are the partners we are working with. But of course, we also discuss with the donors before they donate, to just alert them that we are grateful that you are trying to donate something like this, but we probably have enough. Like right now, it's mask off, so one would want to donate a lot of masks here, but again, even in this country, we are not masking up. So we might not receive some of those commodities. So I think there is a systematic way, and different points, different partners support. But I think that what we do not have is a proper donation guideline.
Great. Thank you.
Thank you. And I'll just add that WHO does have a guideline policy that you can modify and adapt as you move forward with policy development on donations.
Yeah, thank you, Susan, for that information.
Okay. Great. If anybody, we're going to move on to the general Q&A section of this session, and so feel free to add questions in the Q&A function on Zoom. I'm also going to ask Gurmeet to join me in moderating questions as well. But there was a question early on that from Bruce in the chat related to the critical role of collaboration and functional partnerships required to deliver effective logistics. And this was directed at Edward afterwards, but I'm just thinking in terms of the question that Susan just asked about collaboration and partnerships, and as well, when we're thinking about collaboration and coordination for climate change mitigation and adaptation of supply chain adaptations. What are some, from our panelists, what are some examples of where there have been collaborations? What's the role of collaboration and coordination? Any comments or suggestions for this? And Susan, you've mentioned something about coordination of partnerships in donations, but what are your thoughts about those critical partnerships and players across the supply chain? So anybody want to, maybe Edward, you can just address it in the general supply chain, and then we can bring it back to climate change if you wish.
Sure. And thanks for the question, Bruce, and it's nice to cross paths again. So absolutely, I mean, coordination is really critical as we talk about the three key flows in supply chain. Coordination and communication are essential to really keeping the product, money, and information moving. And coordination and communication is critical to alignment among all of the supply chain partners in terms of goals and objectives and operating procedures. And without that, really, the supply chain is not going to function because it's made up of so many different participants. And so thanks very much for bringing that out. And I think it is really critical. And I would just say that as we sort of contemplate changes to the supply chain based on our mitigation strategies, I think communication and coordination is going to be even more important, because obviously the different players in the supply chain they have their own policies, procedures, and priorities. And if you're going to change the way you operate, if you're going to change how you value certain elements of your procurement and distribution practice, then people that are contributing and participating in your supply chain all need to be on the same page with that. So you don't end up with expectations that are at odds with your overall goals and objectives. So communication and coordination becomes even more critical so that everybody is on board with the same set of objectives and the same approaches that you're going to use to achieve them. So there's just my 2 cents.
Great.
And if I can maybe just add from a
Sure.
mitigation perspective, Barbara, I think, you know, when we talk about mitigation, we're referring to often to measuring, monitoring, and reporting on greenhouse gas emissions. And that inevitably, when you're talking about a supply chain, it is a chain. So there's inevitably some sort of duplication of doing this sort of measurement, monitoring, and reporting by the various players as you go through the chain. So having this sort of cooperation between partners, or even having centralized databases, especially because we're dealing with big data, I think that's quite important to have more efficient systems, not just from a cost perspective, but also from, you know, from an accuracy, data accuracy perspective as well. We find we are approached by many potential partners who want to offer tech solutions, and including solutions like blockchain, to ensure that we have some sort of consistency in terms of the data that's used along a supply chain. So I think technology is also fairly important, and then using centralized databases.
Thank you. Thank you. I didn't see any other questions from our audience, but feel free, audience, participants, if you would like to ask some questions, put those in there. But I do know that the panelists probably have questions for each other, and I know Gurmeet has a few questions for the panelists. So maybe I'll ask our panelists if you have any questions for each other, and feel free to raise your hand or just open your mic and let me know. Okay, then I'm going to pass to Gurmeet. And Gurmeet, why don't you go ahead, and I know you had some burning questions that you wanted to ask.
Yeah, thank you, Barbara. Yeah, I guess for the whole panel, and first of all, yeah, thank you all for the presentations again. I think there's a lot of talk lately around the circular economy and circular supply chains. So I'd be interested to hear really if you've seen any successful examples of this in the health supply chain, and if so, sort of what made it successful in your eyes?
Anybody?
Well, I can start perhaps. We haven't really seen that much in Africa, but I know globally the organization has dealt with that. So, I mean, I can't comment too much from a project perspective, but I do know that it is more and more becoming an issue for large organizations. I think, you know, when people start talking about circular economy, I find, especially with our clients in Africa, it seems like something that's very academic or esoteric. So, you know, people are at the moment are more concerned about things like measurement and reporting, and ESG is huge. So it's usually, in my experience, the larger organizations, and mainly the multinationals, that are looking at things like the circular economy. We haven't seen it in the African context from a government perspective yet, certainly, and not in the smaller organizations as well.
Great, thanks, Sayuri.
I would add that the only place that circularity has been regulated so far within the health sector is in Europe. The European Union has policies on circularity that are being implemented within health systems, public health systems throughout Europe. What we've seen is that the most advanced work on circularity is around building and architecture, and the production of building materials that are produced for reuse and repurposing, and that buildings that can be taken apart and put back together using the same materials are being advanced in many places in Asia and in Europe that we've seen. One of the challenges related to circularity is the whole issue of waste to energy, and particularly around plastics. As many people know on this call, during the last UN Environment Assembly, a resolution was adopted to fast track an environmental convention on plastics. And many places now consider plastics as fuel for waste to energy, when in fact they produce dioxins and other pollutants that violate the Stockholm and Basel environmental conventions. So part of the look at plastics and circularity is to look at the materiality of plastics and what are those materials that can, number one, be reused and repurposed or recycled in a way that does not cause legacy toxicity in the plastics. And I think there was a report that we heard yesterday from Greenpeace about how it is a myth that recycling of plastics is ongoing, and part of the myth is that there's not recycling happening, and that the more you reuse particular materials and plastics, the more likely it will end up being a toxic legacy plastic, and depending on whether its uses in consumer products. And there's a couple of really interesting examples in our colleagues in Indonesia and the Philippines have developed recommendations around procurement of materiality in plastics to eliminate single-use plastics and to favor the types of plastics that are reusable. In India, in Nepal, for example, they're autoclaving, steam sterilizing particular plastics that can be melted down and then repurposed from syringe plastic, which is mostly polycarbonate, into shower slippers and buckets and other consumer products that are, for which they're doing cost recovery that is helping support the staffing of the waste segregation and management.
Great. Thank you. Edward, did you want to add to this?
No, I would say just that I haven't seen much in the way of circularity either. I think it's really around ESG and waste management, sort of greenhouse gas emissions as part of the ESG, but circularity has not sort of popped to the top of the list for some of the clients that we're working with.
Thank you. Gurmeet, do you want to ask one of your other questions? Please go ahead.
Great. Yeah, I suppose, yeah, it's related to greenhouse gas accounting. And I think, you know, there are different methods to do it. And it seems like the best method is really to work with your supplier and get very granular data, which isn't always available. So I suppose really the question is how do you identify the hotspots and take meaningful action if you're basing your calculations on sort of stock data from a database or kind of a data library online or something like that. So really how to make meaningful changes if you can't get that exact information from your supplier and on the products you have.
I mean, I think that's where the quality of data or the quality of the supplier, the data supplier that you're using is quite important. I think many of the sort of global databases have fairly up-to-date and fairly comprehensive data available. I think that's why many new service providers are talking about using blockchain so that you have information that can be used, sort of indelible data that can be used, you know, throughout the supply chain. That's sort of what I've seen so far.
Great, thanks, Lily.
And I would add that there are top-down and bottom-up approaches to emission measurement, and the top-down approaches include mostly reviews of spend and volume of products, and then applying what Sayuri was describing is some of these regional input-output databases that are increasingly robust, although quite limited, I would say, in African countries, but in terms of specific data. And I had put in the chat the link to the pharmaceutical lead for the Race to Zero, and a place that, as you are identifying hotspots, to engage with suppliers, to encourage them to participate with other suppliers, whether it is in the pharmaceutical supply chain or other networks within the Race to Zero, where they will get support for measuring, monitoring, and as part of their commitment to the Race to Zero requirements to demonstrate reductions.
And just out of curiosity, I wonder, Sayuri or Susan or Matthews, obviously from the supplier perspective, you can get estimates of what the sort of production greenhouse gas emissions would be. But a big part of it's really around distribution and in-country or a global or in-country distribution. And do those regional and global databases include translators or metrics for applying sort of production dollars or distribution dollars to the development of greenhouse gas emission estimates? Or is this something you really end up having to do through the development and collection and estimation of sort of kilometers moved and things like that in the individual supply chains?
Yeah, I mean, I suppose it would depend on the databases you're using. So remember one of the case studies I spoke about, we spoke about our climate risk modeling tool that we use and the fact that we worked with a number of our different offices. So what we usually do when we're doing, putting together a tool like that is that we'd work with our offices throughout globally, and they, on an ongoing basis, are continuously updating data across the board in terms of different metrics and different currencies, different GPS systems, for example, all kinds of different metrics, so that when you have a specific client, you go and pull out whatever it is that you need. So you can get fairly sophisticated systems, and then you can get fairly simplified systems, depending on the kind of organization you are and the purpose for which you're doing the reporting, I guess.
Thanks.
So Barbara, just to contribute to Edward's question, we've had engagements with a new, remember I said that we have a new ministry now, Ministry of Green Economy and Environment. And one of the questions I asked them, when I interacted with them was that how much of the emissions do we have here in this country? And they were sort of able to give a figure that was smaller, but it's just now trying to understand what the baseline information looks like, because they said we are emitting less than 1%, in fact 0.1% of the greenhouse gases, according to their report. And what was important really was to relate to how developed this country is versus the emission. So they related to our rate of industrialization and also the emissions. So they said we are yet to get to a point where we probably emit more. But I think we shouldn't wait until we have such a situation. What we need to do now is to take precautions, because I think globally the 0.1% is what is coming to 4.4% that we looked at. So I think that out of this meeting, probably, Surya, we could have a chat and see how best we can support, this country. These are baby steps, but we are determined to try and see how best we can get it right from the beginning. We don't have to wait until it is worse. Yeah, so I think we need to have baseline information in all of the spheres where we feel that we have climatic risks and changes that have taken place.
I definitely agree, Matthews. And I think, countries like Zambia who have things like green ministries obviously are helping to create that sort of progressive outlook with regard to measurement, having internal carbon markets as well. I believe that your green ministry is looking at having a carbon credit mechanism and market, and then also the whole concept of internal carbon pricing that private companies are doing also helps with multiple players in the market, multiple stakeholders continuously doing calculations of emissions and pricing, which I think also helps in terms of accuracy of data.
Thank you. We did have a question from Mohammed, and I thank you, Susan, for answering. But the question was, how should we deal with radioactive wastes in hospitals? And I don't know if any of the other panelists, Susan has offered the website from WHO Manual for Safe Management of Healthcare Waste, but is there any comments from the other panelists about the management of radioactive wastes in hospitals?
Well, unfortunately, that's outside my area of expertise. So no, I don't have any comment on that.
Okay. I think we will refer Mohammed to the website that Susan has shared, a couple of websites that Susan has shared, and we will share the questions and answers after as well for others, so that you have access to this information before we finish.
And it is a great challenge, the issue of waste in general and radioactive waste. And with all waste from healthcare activities, it is critically important to segregate, because as we know, if waste is not segregated, all waste becomes hazardous. And so the most important first step is at the source, segregation. And as Matthews was saying, the elimination and reduction of unnecessary products, unnecessary services in order to reduce waste itself. And that's a question, Barbara, if I may, that I was curious to hear more from our colleagues about how, Matthews, you've talked about unnecessary masks, and we've had experience and have interesting case studies from Colombia and from the UK about the reduction of the unnecessary use of medical gloves. And with the pandemic, we've seen a proliferation of medical gloves, and these are not products that can be reused. And so the best way to deal with them, and they represent hotspots, carbon hotspots in the supply chain, is to be clear about for what procedures gloves are necessary and for what they're not. And interestingly, both the WHO, the US CDC, and the African CDC have all said, don't use gloves when you're giving immunizations. And we've seen many, many policy documents that are requiring the unnecessary use of gloves in this way. But again, back to the question, do you have other examples of reducing emissions and reducing waste through eliminating unnecessary products and services?
Matthews or Sayuri or Edward, any?
No, I don't have any examples.
No, nothing else.
I
for
think
me.
maybe just to, I mentioned during my presentation that we are having a relook at our drug list to look at specific drugs, that the so-called chemicals of concern, those that might not be friendly to the environment, even to the patients themselves. And so what would be necessary, won't be an easy undertaking, because I think it should have a cost-related implication as well. So carefully identifying is one thing that might not necessarily need much, but implementing what you have identified with alternatives, I think is what might really slow the whole process of trying to implement the removal of chemicals of concern from the list. Some of the chemicals of concern there, we talk about the use of mercury in some of the medical supplies, a number of cytotoxic drugs, a number of drugs, and septics, a number of chemicals that require to be removed from the, we've identified that, and quite a good list out of the 4,000 list that we have in our essential medicines list. But how do we implement that? So I think that there are other discussions that need to come up. Identifying them is one thing, but how do we implement that?
Great. Thank you, Matthews. All right. We're coming close to the end of our session, and I want to move on and ask us, as we wrap up, we want you to think about this question about what can your organization do to advance climate change mitigation or adaptation in supply chains. And I'm going to ask you to return to Menti. It's the same Menti code that we've used before, 11473969, or scan this QR code. And I'm going to advance to our last question, which is, we want to get your thoughts on your actions that you can do to advance climate change mitigation and adaptation measures in public health supply chains. So let's hear some of your possible actions. So give us a few of your thoughts. What is it that you can do? And we hope that this presentation, this discussion, this session has spurred on some ideas for you. Call to action. We have mainstreaming climate change in the supply chain. So including it in your supply chain strategy, making it an important element of your strategy. Reducing emissions. I think Matthews has offered a few of the things that they're doing in Zambia to reduce emissions by relocating warehouses, or sharing guidance, tools, and information with our members. So making sure that everybody has access to those tools that are going to help them measure and understand the problem, invest in innovation and in expertise, partner with the right organizations, invest in the right data. Empower housekeepers to turn out lights, replace bulbs with LED. Okay, great. Some things that we could actually do in our own homes right now. Stay engaged with policymakers, lead development of policies and guidelines that really help to focus on the problem and the mitigation and what we can do. Love to see any of your other ideas about actions to take. Using purchasing power to advocate, insist on greener or bluer practices. Wonderful. Yes, exactly. So in those relationships that you have with your suppliers and your procurement policies and so forth, incorporate those kinds of guidelines and regulations and policies that really do promote cleaner environment, to promote the reduction of emissions, the reduction of harmful toxins, and so on. Climate change working group for better coordination and communications. Another great idea. I hope that others are thinking of some important ideas, and we hope that by sharing these ideas and actions, join the Race to Zero and COP26 Climate Change and Health Program. Important initiatives that would for good sources of information, tools, commitment, advocacy. Those things all help. Great. Love to see any others that you have. We hope by sharing each other's ideas that'll encourage you as well to create awareness amongst partners, ministries, implementers of the impact of climate change as well. Okay, great. All right. So thank you we're going to keep looking down here. Let me see, come down here and highlight a few others. Vote in elections. Vote for your candidates that are supporting climate change mitigation initiatives. Eliminate diesel backup generators. Use purchasing power. Yes. Great. Well, thank you for all these wonderful ideas, and keep them coming. Even we'll keep the Menti open as we move on, and we will share the results of the Menti polling that we've been doing, and the creative ideas that you're sharing. Create awareness, eliminate diesel, join these important initiatives, use your power to help. Great. So I'm going to turn, as we wrap up here, I'm going to turn this presentation back over to Gurmeet to do our wrap up and our closing.
Yeah, thank you, Barbara. And yeah, thank you all for your participation and all the panelists for the presentations. So just by way of a recap, we looked at supply chains and really at a very top level, what is the supply chain, and saw that it was really moving products to the end users while managing the flow of information and finances to ensure the delivery. And then we also saw the supply chain operates in a system, so not in a vacuum. It's more of a system than a linear chain affected by the environment in which it operates. And therefore, it's heavily impacted by climate change. So we started looking then at the impacts of the supply chain on climate and the impacts of climate on supply chains. And we saw that the supply chain is a major contributor of greenhouse gas emissions. So represents a big opportunity for mitigation and reducing greenhouse gas emissions and reducing the impact of climate. And then we also saw that climate change is impacting supply chains through a lot of disruption, impacting the availability of natural resources to make products, and disruption of chains of transport and logistics. We looked at a few examples of mitigation and adaptation measures that can be taken throughout the chain to really move forward in a meaningful way. And then, yeah, really summing up with some action plans. What can we do in our own organizations? And really, we hope this is the start of a conversation and gathers momentum. There's a lot of initiatives underway, a lot of reporting frameworks and tools that we saw. So really coming together as a community, as public health and supply chain professionals to really carry on doing this work and create some meaningful change. So yeah, thank you all again. And yeah, we look forward to continuing the discussion.
A special thank you to our panelists today, Susan Wilburn from Healthcare Without Harm, Sayuri Mugliar from Strategy and from Pricewaterhouse, and Matthews Malawi from the Ministry of Health in Zambia. And Edward, thank you as well for joining us and sharing all of your insights and activities and what you've been doing in this important area. Thank you so much. And thank you all for joining us, and we look forward to hearing from more. We will be sharing the recording and all this valuable information with you. Susan, did you want to?
Just thank you.
Okay, great. Take care, everybody. Thank you very much.
Thank you all. Have a good day.
Thank you.
Thanks, all.
Bye-bye.
Thank you. Bye.